I'm Jenny Smith, I'm a midwife, and I was a co-author of The Natural Cesarean, a woman-centred technique in 2008, which was talking about family-centred cesarean section with skin to skin. And this has, a lot of other hospitals now adopted this over time.
Great.
And I'm Miranda Sykes, also a midwife, and have been practising Jenny's good work in all the different areas in the hospital.
I'm John Weissmann, I'm an anaesthetic registrar. I've worked in both Chelsea, where you work in Charlotte's, where the formidable Dr. Platt trained me and taught me everything there is to know.
What skin to skin actually means, is it literally full frontal, or can the baby wear a little vest?
I would say the most effective, any skin to skin or any of that contact with your baby close bonding is huge. But what skin to skin actually means is the skin of the baby to the skin of the mummy with the least amount of anything. So it shouldn't be anything, skin of baby to skin of mummy, and then the cover on the top, right beside the heartbeat, where, you know, that whole core temperature of baby here and the core temperature of baby completely together, and the baby feels the heartbeat. The baby has just been in the womb. It's back in the womb on the outside. And that's what you need to do. And then babies get very relaxed, because their mummies get very relaxed, and then the babies get very relaxed. And then the baby's near the breast for those babies who are going to breastfeed, which we recommend very highly breastfeed.
And perhaps a Pavlovian response, when if they feel secure and safe and they've smelt you,
Absolutely.
if they're then upset and fretful or fractious and they're picked up either by mummy or daddy and they smell you, they associate it with being calm.
Yeah.
Yeah.
I always say to mums before they leave the postnatal ward that their default for any crying baby that they simply don't know what to do, close off, skin to skin, 10 minutes, start again. And you can do it anywhere. So I just think default skin to skin, and it just settles everything for all those reasons.
And I think you're absolutely right. And I think it's a physical, psychological thing. With anxious mothers, it relaxes them because the baby's there, they feel the baby there, baby relaxes, mummy relaxes. Yeah. But I think psychologically it's the two sides. I don't know what to do, but I'm going to do this. And actually it just gets you, because you feel the little baby against you, the heartbeat, you know, your heartbeat there, and you're just thinking, relax my jaw, relax my shoulders, just breathe slowly. And slowly the baby sort of melts down with you. And then this sort of distance is the important distance with the skin to skin. Yeah. The mosaic-y look about shapes and the areola of the breast and all these things, that sort of distance is the best distance in the early weeks.
That they can see. It's a default, it's what we lean towards every time. So as I said earlier, if you don't know what on earth to do with your baby, who is going to challenge you so much in those first few weeks and months, because you're still learning their communication. If you don't know the answer, close off, skin to skin, and breathe. And then you can start, and then you can start again and get your manuals out and go, oh my goodness. I would chuck the manuals and just go with what feels right. And skin to skin will reset every single time. It doesn't fail. It's the only parenting method that actually doesn't fail.
So for all those mothers who are having sleepless nights, month 3 to 6 to 9 to 12, this would be
for sure.
top of the list.
For sure.
What then are the key benefits of skin to skin? We mentioned temperature regulation, reducing stress, hearing the heartbeat. What else?
It's a natural pain relief.
It's not just an analgesic for the baby, but also for the mother.
Absolutely.
Actually, the affective component is so super strong actually in terms of your experience of pain. Evolutionarily, we probably wouldn't be wearing our shirts and our jumpers and everything else. We actually would have our babies right next to our skin.
Obviously, you see someone without an epidural, and then they are in sort of painful situations, and as soon as their baby comes out, that stops.
It's extraordinary, isn't it?
It's extraordinary.
Yeah.
Some women, understandably, are quite nervous of having skin to skin straight away because of the muck. Can we call it that? So I get the towel out, and then at the moment, it just shows the primal instinct
Yeah.
They throw the towel off. They just want the baby. So I think that just sort of adds evidence to that it is what we default to. It is
natural.
A completely natural thing.
And it's just magic.
Okay.
If it's not possible to be done immediately,
Yeah.
for instance, a difficult birth or problems or cesarean,
Or unwell mum.
an unwell mum,
Yeah.
can it be done later? And if so, how long should you do it for? And how often should you do it?
Soonest.
No answer.
Yeah.
You do
Yeah.
as much as possible,
Yeah.
as soon as you can, for as long as you can.
Yeah.
That's it. We know the sooner the better. Particularly in the first hour, they call it the golden hour. If you can get a baby onto the chest for as long as possible, you will hugely increase your chances of successful initiation of breastfeeding.
You know, you may have heard about it in your antenatal classes as something that happens at time of birth. I think that's when I was aware of it, really.
Yeah.
Yes, that's when
Yes.
everybody thinks it happens. I wasn't aware that it was something that should be continued afterwards.
And I think that's probably something that's probably the message for me, is that actually it's something that is not just a sort of perinatal thing, it's actually something
Ongoing.
that is really
I mean,
helpful.
that might be something in general for healthcare professionals to look at their literature.
Yeah.
Yeah.
Are we actually making that point clear enough?
You should feel sorry for the dad. You know, everyone's focusing on the mum. They're completely and utterly out of control. They cannot do anything.
Yeah.
Everything they try to do is wrong, and they're terrified. You know, and this is someone they love, and you know, and they can't really share it. So I think actually having an element where they can share in that is very, very important.
One thing that babies can miss if they're not having a vaginal birth but a cesarean is all the good bacteria and things like that, which which they miss out on. And so one of the good things about skin to skin is that we have bacteria on our skin,
Yes.
and antibodies maybe, and this is a good transfer from mother to baby. Presumably the same with a daddy, different antibodies, different bacteria,
But the same
full
family.
dose.
So antibodies probably more in breast milk,
Blood,
if
yeah.
you would agree. Certainly all the sort of friendly bacteria that we cover. So when babies are born, they've been in a sterile environment in the family, but helping them to build up their own sort of skin barrier.
Well, the benefits are extraordinary, and they're not just the cuddly nice to haves. They're medically,
Which is lovely.
Yeah,
But the medical ones are untold.
completely untold,
Yeah.
and it's proven evidence-based benefits. It's free. It is doable by all parents.
Yeah.
If a mother can't do it for some reason, a father can do it.
Yeah.
There's no limit to how often you can do it.
And I think that thing, as you say, it's free. You know, you don't need skills, you don't need equipment. It's not complicated. You're not doing funny things that you wouldn't normally do.
Yeah.
No, it's safe.
It's safe.
Well,
do no harm.
Actually, on the state, I have noticed that this one becomes a little furnace, especially on Daddy. The heat that they give off.
Is it the chest rug?
It's the chest rug. Can they overheat? It's meant to regulate their temperature, but
I think if they are very hot and you know, oh my gosh, this baby's really hot, you can just take the wrap off for a bit and just have skin to skin with no wrap for a bit, or a thin sheet as opposed to a blanket. You know,
If you're sweating, you're pretty much too hot.
too hot. And overheating is a bad thing. So if you put lots of layers and the baby's like this, they can't shiver to get their heat down. You've got to always be careful in beds with cushions and duvets and all that sort of thing, because babies can't get out of them. So if the baby was here and you were skin to skin and you were really out of it and the baby fell down here and then went near the cushion, the baby can't get itself away when they're really teeny weeny. So it is to think about your environment with the skin to skin and make sure that you're quite alert. You haven't had too much wine or something.
But these are those are general principles,
general
aren't they?
principles,
You know,
yeah,
in the
yeah.
end, actually, skin to skin in and of itself,
It's amazing.
as long as you're not overexposing and or overheating, then there's.
and it's not overstimulating them either, is it? Because they can do it fast asleep and get the
It's a
benefits.
pacifying thing more than anything else. It's
Probably as important, if I'd say more important, is the effect it has on the parents. Because actually, kids are super resilient,
Yeah.
right? And actually, what in the end, what really matters in terms of the way they grow up and the way that they develop is their relationship with their parents.
Yeah.
And I think that's it facilitates that bonding process and that transition for the parent as much as anything else.
But one of the really big deterrents to doing it is because you're exhausted, and poppers are a complete nightmare. And if it's the middle of the night and you're doing the 3 a.m. feed and you think, I really ought to be doing this skin to skin, but I just can't, because you don't want to deal with the poppers, you want to turn the lights on, then you could just rip it open because it's magnetic, hilly-dally, and then straight on, assuming that you've derobed in order to breastfeed, and then afterwards, if he doesn't need a nappy change, then you can just do, oh no, he probably does need a nappy change. There we go, and then it's done up, and you can do it all in the dark, so you don't have to wake them up too much. And yes, you see, you could just rip it open, and then quick to the chest. There we go. So there's no excuse not to do it.
Indeed.
Yes.
Anything to make life simple.
Anything to encourage doing something which is obviously so important and beneficial. Yeah. He agrees.
My mummy. The heartbeat, the smell, your voice, in the womb on the outside.
And bizarrely, and we were told this in NICU actually, that the more skin to skin you do and looking at your baby, more close to your baby, the more your milk will come.
Yes, absolutely. That's
If you're having problems with milk because you're not near your baby because he's in hospital or you're working or busy, the milk is free flowing after a bit of skin to skin.
That's your oxytocin levels. The love hormone goes up, and that squishes the milk down the ducts to come out.
So it increases oxytocin.
Yes.
If only you could bottle it.
Yes. On to the Cesarean, where the paper back in 2008 was, I think why that paper was special about Cesarean section particularly was it's the most abnormal birth, and we were beginning to do very well with normal birth in the main, but we took something where it's the baby, it's the mother's baby, not our baby, and the skin to skin into the operating theatre. And there were contentious, you can imagine. The breathing for the anaesthetist. I've got to keep the woman alive, have the blood, I need to check the ob. The surgeon, well, it's this baby that's sort of halfway down the mother, it's going to encroach me sewing up. And then you've got what the mother wants, and the mother wants her baby, it's her baby. So it's actually utilising the space for everyone, obviously, to keep the mother safe. And what we did find, and actually there's a couple of recent papers that say there is no greater risk for everyone to do giving the mother, the baby skin to skin. You've got to move around it. The whole team have got to connect, and that's from your scrub nurse, your runner nurse, the anaesthetist, the obstetricians, the midwife, and everyone's got to join up. Otherwise, things wouldn't go in an orchestrated sort of dance, if you like. But it is very, very possible, and 10 years, it's just 10 years on, many parts around the world are now putting this in place as a norm. And very interesting, it was never tested, it was never a randomised trial. This was 3 of us, and that's why I love this paper, because it wasn't an anaesthetist, it was a midwife, it was an obstetrician, and we wrote together and threaded that paper together for the betterhood of families. And I don't think it's going to go away. And I think it's very interesting because Felicity recently spoke at an anaesthetic conference, and it is unethical now to trial it in areas where we know it's better.
Absolutely, because
Why?
Because the women that would be randomised to not have skin to skin, you're preventing something that is we already know.
So if you it's an established treatment, so you're taking away what is the normal care.
And what is also natural. You're stopping someone doing what inherently they feel the norm to do.
Wonderful sort of bonding experience, and that bonding is of course helped by the fact that the love hormone is oxytocin is released, and mother and baby are both very relaxed, and it also reduces anxiety in mums, the oxytocin.
Wonderful.
So there we are. I'm a great exponent of it, as you'll probably have gathered.